Okay, class, we're going to start with suicide and substance abuse. Now, with the changing world, changing society, so many challenges with work, with relationships, with illnesses, some people cannot cope or cannot cope in a healthy way. And because of that, some people subject themselves to suicide or abused drugs. There are a lot of challenges that people go through in life. Drop out from school, relationship breakout, death of a family member, loss of a job. You can go through the list. At times, people might think they are the only one faced with the challenge. But in reality, there are lots of others who are faced with similar, if not even worse. One of the advice that I usually give students is when you start feeling that way, you start feeling hopeless, that's the time. Don't even wait to get to that point because by then it might be too late in some cases. That's the time to call friends, to talk to family members you trust. That's the time to call your religious leader, your favorite teacher, because you need help. You need somebody to direct you to somebody who can professionally help you. Suicide is a terrible option to deal with issues because once you go that route, there's no return. You only have to make sure that you use those resources. You use your capital, your social capital, people you know, people who care for you. Because most of the time it's very easy for us to think, oh, nobody likes me, therefore. No, people care for you. People like. So it's very, very important when it comes to those situations, say suicides in the among whites. It's much more, in 1999 to 19 and to 2014, the death rate among white rose, increased. And at times there is not one reason for one to really take their own lives. There are multiple factors. But the best thing you can do to deal with these multiple factors is to confide to somebody you trust, somebody who really respects you, you respect that person. That person can help you find resources, find people that can help you to overcome the challenge. At times, the challenge can look at one point as this is the biggest challenge I've ever faced in life. It could be so, and that you are the only one faced with it. Maybe there is a times where you start going, wrong, because life is full of challenges, full of disappointments, full of unmet expectations. But that should not lead to one taking their own lives, because there's always plan B, plan C, plan D in life. See, don't always say, okay, if I don't get this, that is it. No, you don't really know. You might get what you want, and 1, 2, 3 months or 1, 2, 3 years, you don't like it. Now you start saying, why was I forcing all along? Most of the time is when you feel bad, combine it with substance abuse, suicide is likely to happen. You feel bad, stay away from drugs, legal or illegal, because when you overdose, it might be legal, but when you overdose, you're now abusing the drug, and the drug can kill you. And also the prevalence of alcohol and other drug abuse. These are also other challenges. Everywhere you go, there is some form of alcohol called different names, made so sexy, easy access to. And when you combine it with other drugs, you have this synergistic effect that is too much for your body to handle. And that can lead to death. The history of mental health care in the United States. Response to mental illness characterized by periods of enthusiastic reform, followed by periods of widespread ambivalence. One time there was that hype, people really wanting to be able to try to develop or try to respond, try to deal with people dealing with mental illness. It has always been one of this. At one moment, everybody gets really involved. Let's say even right now in our country, the increase of the use of opioid. There is a kind of rise. There's a kind of enthusiastic desire to really address the use of opioid. Again, as with anything within this country, there's always the motive factor. Why? Because most of the people who are being killed by using opioids have been white. So it will get to a time wherein people are just laissez-faire, kind of, when that is put under control. Drug abuse has been a problem in this country for a long, long, long time. Since people came from Europe, when alcohol became a biggest issue, men drinking excessively, not taking care of their responsibilities as husbands, and that became an issue. They had to put laws. The Reformation, they had to do away with alcohol, trying to put laws that can terminate the use of alcohol. But as with anything, as long as there's a profit motive, it's easier said than done, because alcohol was a profitable business for some, even though it destroyed a lot of homes, a lot of families, and even up to today, a lot of homes and a lot of families are being destroyed. So there are certain laws that are in place, but how much of those laws are really being implemented effectively? So mental health care before World War II. You have colonial America. People with mental illness cared for by families or private caretaker. See, it was a shame to the family. So what the family will do is they keep it private. And this were for those people with means, because for those people without means, they were put into institutions. We started having mental institutions during the 18th century. See, because there is something that is stigma, it's a stigma. By then, there was not proper diagnosis of really what causes some of these mental issues. And so in most cases, people who were affected by mental issues, especially within the family, it was considered a shame. They keep it private. Those with means and those without means, government had institutions, mental institutions. So in the 1800, we had the first institutions being developed to house mentally ill patients. Population growth led to institution growth. You have harsh treatment and unpleasant conditions, especially when you have who were those people that were really in those mental institutions. And by then, most of the time, people do not know better how to really treat some of those people suffering from mental conditions. So they were faced with a lot of harsh treatments. Began in 1792, believes that environmental change can affect the mind and alter behavior. That was the belief, which can contribute. But in reality, there might be some other mental issues, some chemical imbalance. So the science was evolving. More people, more people from setting causing life stressors into rural, peaceful settings. People thought, well, if you move people from one setting to another, that might help, especially when you think of people trying to develop. Very stressful. And some people do not have the appropriate skills to cope with those stressors. So they were moved into rural, peaceful settings, appear to have success and become widely acceptable. So because especially when you talk of mental illness, it's a broad spectrum from stressors, from imbalance to other mentally certain destructions in the brain, overcrowding due to population growth. Some people cannot do well in a crowded environment. They become phobic. Too many people, one place, clustered. That's enough to trigger some mental kind of issues. Then you have state hospitals. Now, state hospitals supposed to provide therapeutic environment based on close personal relationship between patient and well-trained staff. And there was deterioration of services occurred as chronic nature of mental illness was discovered. Long-term or lifetime stay were the norm. Maximum capacity quickly reached. Personalized care lost. Restraint became more practical. Staff turnover high. Say from therapeutic environment where in relationship with patients well trained was okay. Later on, they realize, oh, this could be a chronic nature of mental illness. It's not just something that is going to be treated one. Something, some people had their mental issues for a lifelong, which was also another challenge. More people were admitted. So now you're talking about space. Now you're talking about staff shortage. So that personalized care that patients used to have now is group. So people were restrained, tied up, kept in solitary isolation. And staff turnover became high because patients will abuse the staff and the stressors were just too much. So in 1940, populations in state mental institutions was nearly 500,000, which is a big number. Staff caseload so large, only subsistence care possible, minimum. Not really those care that you can, Then there came this ECT, electroconvulsive therapy, was introduced in response, wherein people were shocked, hoping that when they are shocked, given some form of shock, that can get them their mind right. Then you have the lobotomy practice, practice of new medication in 1950s, made widespread use unnecessary. Now, mental health care after World War II. The National Institute of Mental Health was established. Now, one thing you also have to bear in mind that when people went to war, they were faced with trauma and a lot of mentally related issues. And it was the responsibility of the government to make sure that these people are taken care of. Because most of the time people leave America, healthy young boys, and come back home messed up mentally and physically. So you know, the National Institute of Mental Health was created to foster and aid research related to cause, diagnose, and treatment of neuropsychiatric disorders, to provide training and award fellowships and grants for work in mental health, to aid states in prevention, diagnosis, and treatment of neuropsychiatric disorders, mental disorders. Okay, and some of those, in most cases, some of them were mainly for veterans. But others as well could also take part in it. The general population could also take part in the study or in the services that they provided. To deinstitutionalization. The deinstitutionalization means discharging of thousands of patients from state mental hospitals. Instead of putting them in institutions, they were discharged. Now, at times, was that the right thing? Well, again, that the institutionalization was propelled by economics because it costs more to keep them in institutions. Idealism, you have legal considerations, and antipsychotic drugs. Then you have the mental retardation facilities. Yeah, okay. You have community mental health centers were built to help with mental retardation facilities and, and community mental health act. Community mental health centers, fully staffed centers, originally funded by the federal government, providing comprehensive mental health services to local populations. Now, they had five core services: translation, problem of trans institutionalization. You have community support programs. Then you have the mental care concern in the United States today. See, most of the time when we hear about some of these, so many shootings, is it part of a mental situation? Because everything being normal, somebody in their good mind, in their good mental settings, will not be willingly ready to kill some other person. So maybe in our communities, we need to provide some resources that can help deal with some of those expressed mental conditions and unexpressed. Because some you can easily see people with exhibiting mental issues. Others you cannot see, but those mental issues are there. It only takes a situation or an event to trigger some of those mental disorders. So mental health care concerns in the United States today, experiences of people with serious mental illness have improved significantly in the past 50 years because there's better study of the brain, some of the stressors, some of the things that leads to certain behavior types that could be considered a disorder. So yes, it has improved, but there still remains some challenges. Challenges remain: how to provide services to the homeless, because there is the feeling that most of those people, the homeless, have mental issues. Just because of certain environmental issues or societal issues that might have triggered certain conditions in their brain. So now, how can we provide adequate service, mental health care service to the homeless? Changing prescription that mental illness is linked to extreme violence. changing perception. That mental illness is linked to extreme violence. Resolving problems of those with mental illness who are incarcerated. See, these are real concerns that needs to be addressed. 2.1 million adults experience homelessness over the course of a year. 80% temporarily homeless, 10% episodically homeless, 10% chronically homeless. So what can we as a nation do to reduce the prevalence of homelessness? But there's nothing that can really get the human being to really lose their self-worth when they are homeless. Is it jobs, type of jobs? So most of the time, I think, we have to still find out why some of these people are homeless and how best can that situation be controlled. About half of all homeless adults have substance use disorder. Again, homeless, hopelessness, what keeps them at least kind of happy or whatnot is use of drugs. And once the drug, the dosage, the effect is down, that results into major depression. Then you have the cycle, go back for more drugs. Then and other co-occurring mental illness. Successful intervention include provision of housing and services they need. See, when they are provided with appropriate housing and also provide services that can monitor their behavior, their drug use related behavior, so that they can have a sense of hope, have a sense of value, that they are somebody. Because most of these things are as a result of a big sense of hopelessness. I'm a failure, I've amounted to nothing, and life is just hell. See, I think everything being normal, some of those conditions can be corrected. You have the mental illness and violence. extreme violence relatively rare in people with mental disorder. Much of risk attributable to comorbid factors, other factors. Somebody having a mental issue then uses drugs can contribute. But just the mental disorder alone in itself, at times it happens, but it's not as often. What should be done to prevent violence is unclear. Constitutional issues related to individual freedom, privacy, and other rights. See, usually that's where the whenever there is, even right now, there's the big debate about gun violence. You have the individual freedom to own a gun. And also, you have the individual privacy. You cannot just go and shoot somebody for no cause. So, until there is a way that people come up with a better way of addressing this, some of these issues will always be around. Mental health care in jails and prisons. Rate of serious mental health illness in the US. Correctional facilities are 3 or 4 times the rate in general populations. Well, some of them either before they got into prison or maybe the prison has just created an environment. So, is there anything being done in prisons to address some of these mental health issues, mental health situations? Correctional facilities designed to confine and punish, not to treat disease. So again, this is also the other problem. Our jails are not there to treat, they are there to confine and punish, not to treat disease. Maybe if it's kind of modified, to confine and also investigate why do they behave like that. Find ways to provide treatment. See, because now we know that most of the people in prison have some mental issues. Instead of continue to make the mental issues worse by confinement and punishment, why not try some treatment so that when they come out, they have a better way of dealing with their mental issues or mental challenges. And the correctional facilities lack of space, adequate number of qualified treatment personnel, and timely access to service. So we always come up with, we don't have adequate space. We don't have adequate number of qualified treatment personnel, people who can offer that treatment. What is our intent? Are those people sent in jail to be punished or confined and just throw that population away to a life of crime? Or is our intent is to make them better people when they come out? I think in addition to some of those expectations in the jail, there has to be some form of treatment so that the conditions of these people don't get worse. Because at times when it gets worse, it becomes more problematic for the individual, his family, and society at large. Once released back into a community, more likely commit crime if untreated. You have the what is this? One day they are out, the next day they are in because the root cause has not been treated. See, most of the time it goes back to some of the core principles of the social determinant of health. If somebody is treated from a community and then released back into that same community, and after some time that same person comes back for the same treatment, you're really not doing that person or this community any good. When that person goes into prison, that person should be taught. Those without skills, taught skills. Those with issues, try to resolve those issues so that when they come back, when they come out of prison, they will not be tempted to commit crime. They will have a reason to stay out because now they feel productive. They can contribute to society. But when they went to prison without skills and left prison with hardly no skills, or if they were dealing with mental issues, those mental issues were not treated, they come out, they are likely to repeat those crimes. And at times, if you don't watch it, those crimes can even be worse than the first one for which they were put in jail. So we have to find a better way to deal with some of these issues. We have the prevention, primary prevention, secondary and tertiary prevention applicable to mental disorder. So first of all, the primary prevention is you try to reduce incidents of mental illness and related problems. Try to reduce, try to know the root factors. What are the stressors? What are the conditions that leads to this? Then try to address those conditions so that the person might not experience mental illness. Then you have the secondary prevention. You reduce the prevalence, people coming, by shortening duration of episodes so that people might be treated and also shown Either it could be a therapeutic form of treatment, and in some cases, maybe if they have to leave that environment, change the environment, provide support so that they will not have to stay long. So the secondary is reduce prevalence by shortening duration of episodes. This is very, very important because most of the time, depending on the sort of type of health and condition, it's one of those that there's really no definite, the only thing is you can prolong you can prolong a point wherein people can really get into that relapse. And if they relapse, they can easily be treated and get out of it. So it's very, very important that some of these things, now the knowledge is there. But is the commitment there to make sure that our population, that is every population, is treated, given the appropriate treatment to reduce some of these mental issues. Then you have the tertiary treatment. The treatment and the rehabilitation. Again, most of the time is once the treatment, the rehabilitation is very, very important. Try to rehabilitate these people in an environment that is conducive for mental health, not an environment that is toxic, that will get them back into those situations. Unfortunately, most of what happens is people are thrown in jail for some years, or people with mental issues. They go in, being treated. Some form of rehabilitation is done. With part of rehabilitation is also is a lot of primary, so that they don't do those things that they did that can get them mentally ill. But we go all the way to changing those environments, those social structures that contributed in the first place to the mental illness. You have the treatment approach. You have goals of treatment of mental disorder. Part of it is you try to reduce the symptoms. See, because there are certain mental situations wherein, depending on this type of mental situation, it's like a glass that is cracked. It's very difficult to really do away with the crack. But one thing you can do, you can slow the rotation of that crack wherein it gets to a point wherein the mental issue becomes an issue. And that is by dealing with the social structure, the environmental structure, the type of care that person gets. And some of it is to improve the personal and social functioning, because certain mental disorders would really do away with those things. Develop and strengthen coping skills, and promote behaviors that makes a person's life better. Okay, we stop here for today, and we're going to pick it up the next time.